Hello, I'm Dr. David Jayne, a family practitioner in the Oklahoma City greater metro area. Today I'd like to talk a little bit about male sexual dysfunction. Males over the age of 40 frequently find that they're starting to have problems and issues with sexual dysfunction. That can include losses in libido, which is desire for sex, difficulty maintaining and obtaining erections, and other issues related to sexuality, including prostate issues. As a family practitioner, I have lots of experience in dealing with these issues, but I usually take a unique approach which involves hormone replacement therapy, supplementation with a hormone called oxytocin, as well as a new procedure I've been trained in which helps erectile function. With hormone replacement therapy for men, we check testosterone levels and DHEA levels mainly, and when those levels come back, even in the low normal range, if you're having symptoms of low testosterone or low DHEA, which include fatigue, weight gain, loss of interest in sex, difficulty having erections and maintaining erections, and difficulty focusing and concentrating, mood changes, all those things can be associated with low testosterone, even if your testosterone is in the low normal range. I therefore recommend that we try to optimize your testosterone levels back to an age, approximately age 30 or so. When we do this, this causes a lot of significant improvements in several aspects of your life, but I think the studies really prove that having higher normal testosterone levels than lower normal testosterone levels have benefits in reducing risks of chronic diseases as well as other benefits to your life. I also recently have started prescribing oxytocin in supplementation to males as well as females, but in males especially, this really adds to the benefit of testosterone and DHEA in mood and sleep and focusing and concentrating, as well as increasing libido and helping with erectile dysfunction and orgasm issues. The last leg of the plan that we use is a new procedure called the Priapus shot or the P shot. And there's a link provided to Dr. Charles Runnell's website, who provided the training for the procedure, which I'm now successfully performing in the office here. It's used for erectile dysfunction, and it can be used to help men who want to rejuvenate the penis. And by doing so, we draw a little bit of plasma and blood, and we spin it in a tube, separating the plasma from the blood. We activate it with a very small amount of calcium, and then we inject the plasma back into the penis in multiple injections after using a topical anesthetic. In doing so, we activate the healing process, which helps rejuvenate the collagen, blood vessels, and tissues in the penis. Over 3 to 6 months, this can produce results improving erectile function. The procedure is relatively painless. The risks are relatively low with bruising and infection, the possibilities. The compound itself is your own plasma with platelets, and it's rich in all the growth factors. So since we're injecting your own plasma back into you, it's theoretically low probability that you would ever have any sort of reaction to it. The procedure is very well tolerated, and for some men can produce dramatic results.